So, there's a lot of ways that COVID-19 is revealing inequality in and inequity in our culture. Um, I'm sure we're very aware of class inequality. There are some folks that are doing just fine. They have jobs they can do remotely. They're still making plenty of money. Um, they're just bored at home, right? I know I've been annoyed at some of the stuff I've seen on TV where people are trying to combat boredom, um, while some of us are working while homeschooling our kids. But I'm still extremely fortunate because I am working. There are folks who are not working, who are struggling to get a hold of unemployment, that can't pay their bills. Um, this is affecting people differently. Now, we've talked a little bit in this course um, about inequality from data. And the CDC has started covering this a bit. And if you've been watching the news at all, you know that this is sort of a breaking story the last week or two. Not very surprising, unfortunately, but this has to do again with what sort of data are we tracking. Otherwise, we're not going to know what's happening. So, preliminary reports indicate that communities of color, um, Black Americans, Black and Brown Americans, Hispanic Americans, are disproportionately affected um, by this disease. The disease itself may not discriminate based on race or class or whatnot, but the effects, the access to quality health care, the access to testing, whether or not that person can socially distance by working at home, whether they have to continue to go to work and be exposed to people. These are things that are not spread equally across race and class. And the CDC is hardly a liberal propaganda machine. And so it's a good place to look for this because they're going to reflect just the numbers on the ground. And the data suggests overrepresentation. Now, what does that even mean? All right, so I'm not trying to pick on conservatives here. This was just an accidental find. But I was on Twitter a couple days ago and I saw this hashtag, signs you're a COVIDiot. That's kind of funny. And the interesting thing about this hashtag is that progressives, moderates, and conservatives are all using it. So that's kind of funny. And anyway, this person, conservative lesbian, had posted this table. What I thought was interesting about this is the tweet says, for those knuckleheads saying this virus impacts brown and black people more than white, shut your face. And so I looked at it, and I'm a math teacher, so you'll forgive me, I had to reply. I mean, politely too, because I'm not a troll. So, proportionally, this is me. Your image is evidence, not refutation. The claim is that it disproportionately affects people of color. So, what was happening here? This is a great example of quantitative literacy. This person had looked at this chart and saw that the biggest number of confirmed cases were white people. Most confirmed cases are white people. But of course, most of the people, and this is from one particular county, presumably where this person lives, most of the people in that county are white people. You'd expect most of the cases to be white people. What's concerning about this is look at the other numbers. There's a greater percentage of Asian confirmed cases than there are percent in that county. There's a greater percentage of Black or African American confirmed cases than there are in that county. There's a greater percentage of Hispanic than in that county. And keep in mind, these are confirmed cases. People aren't testing uniformly. I can't tell you how irritated I am at every rich celebrity who's asymptomatic who's gotten tested. Meanwhile, we routinely see stories of sick, ordinary people who can't get their hands on a test. So this is about proportionality. You would expect these numbers here to be reasonably similar to these numbers. Now, it's the case that you would expect some variation. So it's not necessarily the case that these are higher because there's a problem, that this is just one county. And again, the CDC is reporting that there is sufficient data to suspect a disproportionate effect. But this table doesn't actually support what this person is saying. Anyway, we ended up having a nice conversation on Twitter, and it's all fine, good. But if you're trying to make an argument on social media, be careful what you use for evidence, right? Again, nothing wrong with this person. I'm sure they're perfectly reasonable, but they just didn't understand what this table was saying and that it wasn't supporting their claim. So there's a couple resources that I'll put in the slides. This is one with the Brookings Institute. Brookings Institute is classified as moderate to left-leaning. It's a nonprofit where they do data analysis. So take that for what you will. All right. There are many places around the country where all the deaths are Black Americans, or the predominantly Black Americans, right distinctly out of proportion with the representation in those neighborhoods. And there's a quote here I want to read before we wrap this up. And it's this one, this paragraph. To date, the U.S. has employed a colorblind policy to COVID-19, as stated by Stephen Thomas, Director of the Center for Health Equity at the University of Maryland. However, a colorblind approach cannot bring about equity when both the healthcare system and the structural conditions that inform it are so unequal. Focusing on the most oppressed and vulnerable among us creates a pathway toward health equity that will help everyone beat this pandemic. Okay, a couple things about that. Let's go back to the CDC. So it's a pretty good article here. It's a little dry, but they talk about what sort of factors might be impacting community of colors. So again, this is the CDC, hardly a liberal propaganda machine. Bullet point 1. Members of racial and ethnic minorities may be more likely to live in densely populated areas because of institutional racism in the form of residential housing segregation. People living in densely populated areas may find it more difficult to practice prevention measures such as social distancing. Here's the fact of the matter. History happened, and history is connected to the present. And all the stuff we watch about on award-winning movies about the 60s and 70s wasn't that long ago, as I've talked about in class. Segregation, the effects of segregation persist in terms of loan approval, zip code, correlations with poverty and credit. These things persist, and they're affecting some people more than others. This notion of color blindness, which is the sort of thing that white progressives say. They say, I don't see color. I don't judge people by color. And what they're kind of literally saying is they don't consciously do this. And I believe them. I think most white progressives like myself consciously do not think that they're making decisions based upon a person's gender or a person's race or ethnicity. But that doesn't mean it doesn't happen. In fact, there's substantial data that it does, regardless of what they think. There is the importance of some data. If people were really acting the way they say they are, we wouldn't see the disparity in data that persists in education, poverty, employment, and now during this pandemic. This has to be about more than the fragility of our egos. We have to come to terms with our history. We have to come to terms with the policies and institutions that perpetuate disparity. It's hurting people. We have to be able to own up to it. Now, in this Brookings report, they use the term equity. So let me find you a pretty illustrative cartoon to wrap this up with, because equity and equality are not the same. So this is a version of a popular, I hesitate to say cartoon, because it's not amusing. But if you type in equality, equity, cartoon, you'll find this if you do a Google image search. And here's the idea. In the first panel, you have equality. Three people with different physical characteristics are standing on the same size box, and the same barrier is in front of them as they try to participate in society. Right? One person has a clear and easy view. They can participate. They can see what's going on. The second person gets by because of equality. But then the third person, they're still screwed. That's equality. Treating people equally is like making somebody in a wheelchair climb a flight of stairs. So equity would be providing different measures for different people, right? So now each of those three people can see the game, but unequal measures have to be enacted, right? So this is like wheelchair ramps or elevators or whatnot, it would seem. This third panel is not always in the strip. Reality, right? The reality is that some people are significantly more advantaged than they have to be. Just look at wealth percentiles in the country, and some people are disproportionately affected. And then the third panel is very powerful. This is the notion of liberation. It's the fence. The fence is the problem. It's not the boxes and it's not the people. It's the fence. And sometimes the fence can be very hard to see because we're too busy talking about boxes and differences. We can blame the person who's not tall enough. We can be outraged that some people get 2 boxes versus 1 boxes. Or we can say that the person with a tall stack of boxes worked hard for those boxes and they deserve their boxes, and the person in the pit shouldn't dig a hole in the ground, and so on and so forth. But it's about the fence. If you remove the fence, none of them needed anything to begin with. So what's the fence? Who built the fence? Why is the fence there? In some versions of this comic, you'll see a chain link fence, which accomplishes what a fence needs to do, while at the same time providing visual access. This is something to think about as you're hearing reports, maybe experiencing things yourself. What are the fences in our society that are causing disparate impacts for different people who certainly don't deserve these different experiences? We have an election coming up in the fall, and I always encourage all people, regardless of your political leanings, to vote. It's a democracy. The entire House of Representatives is up for re-election. 1/3 of the Senate is up for re-election, and so is the president. So this is a time to consider, what's the fence? What sort of things need to change to make this a more equitable society, to make it a society that brings people together, that keeps them safe, that provides? I don't know. I don't have all the answers, but there are some answers out there, and there are answers in data, there are answers in graph. And if those aren't the answers, then at least provide information and evidence to help you form your own answers based upon your beliefs and what you value. Now, this isn't your typical kind of math class, but that's a good thing, because the quadratic formula, SOHCAHTOA, mx plus b, these aren't really helpful right now. I hope you and your family are safe, healthy. Best case scenario, I hope you're happy. I hope we all get through this. I hope I see you in the fall. Or if you're graduating, hope you find a great job doing what you want to do. I hope it all works out. I'll be thinking of you. Take care.